Hi everyone, I'm Melissa.
And I'm Sarah Hardman. I'm the educator for 3 South and 11 South Medical here at Memorial.
And we have an exciting opportunity to pilot having an LPN orient to the mother-baby unit. So we thought it would be best just to share a brief video highlighting some of the information about this opportunity. Sarah, would you mind sharing that information?
Sure. So 3 to 11, we have had LPNs on our unit for about we're going on 3 years now, and it has been awesome. So these are amazing individuals. We started off with hiring on 3 LPNs and now we're up to about 14. So they have a variety of skills, they're flexible, they have floated to tele units, they floated to outpatient surgery, we have some in floating to infusion center right now. So they have a lot of different things that they can do and that your unit will definitely benefit from. So 3 years ago, we started off with team-based nursing where they would be paired up with an RN. But after looking at their scope of practice and modifying the matrix, we realized that they could care for their own team of patients. So now they're carrying 6 patients.
That sounds really great. So tell me a little bit more. So do LPNs currently work under an RN license or are they operating under their own?
So they went to nursing school, they took the NCLEX, so they are operating under their own license.
Amazing. So you mentioned a little bit about the team-based nursing. So are LPNs currently taking their own assignments?
They are. So they take up to about 5 or 6 patients. They pretty much do everything for those patients, but there's a couple things that they cannot do. So when a patient is admitted, there has to be a full head-to-toe assessment completed. That does have to be completed by an RN. And then also the first post-operative assessment that has to be completed by an RN. There's a list of high alert medications that they aren't able to administer. So on our units, it's usually like IV hydralazine, labetalol, heparin drips. They can be the witness for a blood transfusion, but they can't be the administrator. Same with PCAs and epidurals. So all this comes from, there is an LPN scope of practice that can be found on the Beacon Internet. And the last couple pages are the matrix. So it will look like this. And so it gives you everything that the LPN can and cannot do, which there's very little that they cannot do. So that's awesome. And then there's also a restrictive medication list. So anything in this box they are not able to administer, but I will say a lot of these things require cardiac monitoring anyway. So.
Well, thank you. I also have been just kind of scouring the A1 Community Guidelines Hub website and also looking to see what opportunities we have with this. And LPNs are already currently being used in several OB units across the United States. And so there's a lot of information that's become available and we'll be utilizing that as well as resources. Thank you.
All right, thank you.
I'm here with Megan Salyer. She is one of our CBU educators and also a clinical instructor for IV Tech. She does teach the OB clinicals. And Megan, you've had not only the opportunity to teach the LPNs, but also work alongside them in the past. Would you mind sharing just a few tidbits of information?
Yes, I came from an LDRP in North Dakota, and we had LPNs that worked on our mother-baby unit. And probably one of the most experienced nurse on the mother-baby unit was an LPN. And so she had a wealth of knowledge that she was able to share. She was great to help with breastfeeding and taught me a lot. I learned a lot probably in the beginning of my career. And I teach both LPNs and RNs in the mother-baby, and their curriculum is almost the same as far as mother-baby. So they can do a lot. I think they do more than than people think they can. So they're very intelligent and very excited, and I think they will be a great addition and asset to our team.
Thank you. I would like to introduce all of you to the LPN that is going to be coming to the mother-baby unit to orient.
Hi, I'm Mackenzie.
Mackenzie, would you mind just sharing a little bit about yourself with us?
My name is Mackenzie. I am currently in school at Ivy Tech to transition from LPN to RN. I'm supposed to graduate in May of next year. I have wanted to work in mother-baby / labor and delivery pretty much my entire life. I knew what I wanted to do at a small age, and so I didn't think I was going to have this opportunity for years to come, so I'm very excited.
We are very excited to have you join us.
Thank you.